Okay, thank you and good afternoon, everybody. Before we look at the data from today, I wanted to talk with you a little bit about some of the steps that are being discussed to reopen the economy. As healthcare professionals, we fully understand the tremendous economic strain this pandemic is having on people in the region. That impact is hitting people in all walks of life, particularly those that are socioeconomically disadvantaged. We have to reopen the economy, and we have to do it gradually and safely to avoid a future healthcare and economic crisis. We know from past pandemics that if we relax social distancing too quickly, there will be a second wave. That's why our steps in the weeks ahead must be gradual and safe to give businesses the information they need to reopen and the public the confidence that they need to go out and engage in our economy. As I mentioned yesterday, leaders from government, public health, and business throughout the region are working together to plan for a reopening that gets the economy back online and includes important steps to protect against a dangerous second wave of the virus. Our healthcare systems will play an important role in supporting that crucial work. Across the region, our reopening framework must include important safeguards, including testing and contact tracing and continued social distancing. We will have a balanced and thoughtful approach in our region. Now let's take a look at the data for today. Our numbers today are fairly similar to where we have been in recent days. We currently have 678 hospitalizations, down compared to yesterday when we had 690. And again, this number will fluctuate daily, and we need to keep our eye on the trend over time. There are 159 ICU patients, which is up slightly from 154 yesterday. And there are 113 patients on ventilators, which is up slightly compared to 109 we had on Saturday. And just to reiterate, these are COVID plus patients under investigation that we're talking about. And here's the good news for today. Another 50 COVID patients were discharged yesterday, and that brings us to a total of 1,167 patients who have been discharged from our hospitals since the first confirmed positive COVID patient. The number of patients in the hospital is still very elevated from early April when we first started this initiative. Despite all the progress we have made, there is still about 45% more patients in the hospital because of the virus than there were on April 5th. I do want to reinforce, however, that the region's diligence in social distancing has been highly effective in suppressing the first wave of the curve. Early on, I shared the worst case modeling predicted that our hospitals would have been overwhelmed with patients, particularly patients in the ICU and on ventilators. As a region, we all sacrificed by staying at home and social distancing, and we were able to move off that worst case trajectory and onto a much flatter, more gradual curve. The modeling forecasts that the peak hospitalization date for the region would be around April 25th. When we look at the data over time, we can clearly see that our hospitalization rate has been flat and stable. The chart that I'm showing you now is a 7-day moving average of hospitalizations across our task force members, including today's numbers that I just reported to you. This includes both confirmed positive COVID patients and COVID patients under investigation who do not yet have a confirmed positive test result. But what you can see on the trend line is that it's been very flat over the past week after a steady rise from early in April, and our hospitals have been able to manage the volume within our existing capacity. If our modeling holds true, we should start to see a taper over the next week or so, and it will start to move back down gradually. That's when we will know that we are in fact on the downward side of the initial wave. We want to keep this trend coming down over time, and that will require continued vigilance and discipline. We aren't headed downward yet, but this plateau is encouraging, and it's only possible because of the dedication and the sacrifice of everyone in the region. What we have done has worked very, very well, but we have to attempt to reopen the economy relatively soon and extremely smartly. We have to continue to drive down transmission within our communities in the weeks ahead, and we want to see the hospitalization data start to decline as well. As we move forward, I'll continue to share with you our daily numbers, and we'll also keep you updated as we begin to see trends in the days ahead. And now I'd be happy to address some of the questions we have received from the media.
According to our tracking of the statewide reported cases, 65% of the statewide deaths are in St. Louis City and County, and 55% of the statewide reported cases are in the St. Louis area. Why do you believe that we are being hit harder than the Kansas City area?
It's a challenging question to answer. We definitely have seen more cases and more mortality in the St. Louis metropolitan area. And it could be for any of a number of reasons. St. Louis could have experienced spread earlier in the pandemic, some unrecognized spread. And so it was allowed to become much more seated in the population, which then again, you're going to see more hospitalizations and more mortality. There could have been pockets of increased spread amongst some sections of the community that drove some of those numbers as well. It's really hard to tell at this point in time. We'll have time after we get through this pandemic to go back and see how that spread occurred within St. Louis that we didn't see in other parts of the state. But it's really tough right now to pinpoint on any one or two things that can really explain why St. Louis has been hit harder than the rest of the state.
The region seems to have reached a point where it is beginning to focus on testing so the economy can reopen. You've spoken almost daily about the need for testing. Is there finally enough diagnostic testing in the region to begin the reopening conversation?
So I have spoken daily about testing, but it has always been in the context of needing certain things in order to reopen. So not only do you need adequate testing where anybody that is feeling sick can go and get tested, and the CDC has broadened their cases, their symptoms for which you can get tested for, and so it's a much broader group of people that can now get tested. And so that has to be paired, though, with contact tracing and isolation and quarantine. It really doesn't do us any good to test if we don't have those other mechanisms in place. The second piece of that is we also have to have some wraparound services to support people if they are testing positive and do need to be quarantined. But in answer to your question about testing, we do believe that more testing is becoming available now. I was out at our lab today and was discussing this with them, and they did recognize that there are more supplies becoming available now. Now it's certainly not, the floodgates haven't opened up where we can do large-scale prevalence testing, but we do believe we have more capacity now to do testing. And the other piece of that is there's multiple different types of testing that are going on now. So you have testing that goes on that's ordered from a physician's office, some at some of the drive-through clinics, some is occurring in the hospitals, and some is even including in some private places like private businesses and things like that. And so there's a lot of different forms of testing going on right now that nobody really has a good handle on how much is occurring. And we do believe that testing will become more available into the future, particularly as more technology comes online with faster testing and easier ways to get tested.
Regarding antibody testing, you've repeatedly stated that there are many unapproved tests in the marketplace, but we understand that there are some very reliable tests now being mass-produced by the private sector. How long before those reliable tests are readily available in our community?
So a couple of things about antibody testing. So there are a couple of different types of antibody testing. So some people may be familiar with the lateral flow, which is the finger prick, and you put it on a little pen, and then it gives you a positive or a negative. Those are the ones that have there's a lot of variability on how reliable they are. The second type is the type that's run in a lab, like in a hospital lab, and that's the ELISA-based testing. And those are going through validation right now, and those are typically much more reliable than the lateral flow test. I can speak for us at SSM, and I know at BJC that we're finishing up our validation testing right now, and we believe that those should be becoming available within a week or so. So we believe that we're finishing up that testing. It should be successful, and then we should be able to begin offering that. Now, let me caveat those things with one other issue, and I've said this before: is antibody testing shows the presence that you were exposed to the virus. There's some cross-reactivity in some of these tests with other coronaviruses, and so you have to be really careful about what that positive test means. And it also does not mean complete immunity. And so that's where the challenge comes in, is what does a positive test actually mean? And nobody can answer that question right now. All it can really tell us from a very practical point of view is who has been exposed and who has not.
At the federal level, they've turned testing over to the state and local level. Do you feel there is sufficient collaboration in our community with regard to diagnostic testing and antibody testing and contact tracing?
I do. There has been significant collaboration amongst the healthcare systems that are within the task force, collaboration within public health as well. And then the coordination with sort of the private sector. So again, if you think about where testing occurs, it can be from a private physician's office, it can be from public health, or it could be from our inpatient or hospital-based labs. And of those three, the healthcare systems and the public health have been coordinated on testing, what types of testing, who to test, all of those other things.
Could we be doing anything better to coordinate in order to expedite the reopening process?
I think we're covering the majority of issues to expedite reopening. And I'll go back to some comments that I made yesterday, which is, this is really, it's a once-in-a-century pandemic. And so nobody has the perfect playbook on how to go about reopening. There's a lot of good ideas, and the majority of people, understand what those ideas are as far as reducing transmission in the community, making sure we have all of those public health measures in place, and then making sure our healthcare systems can take care of COVID patients. And the healthcare systems have been working with public health and with businesses so that we're all aligned on the same framework. And that's the important piece, is that we're all talking to each other, so everybody's cross-leveled on what the expectations are.
Has the American healthcare system failed to coordinate an acceptable pandemic response with regard to testing?
Well, I think failed is a pretty strong term. So what I would say is, again, going back to this is a once-in-a-century pandemic of a novel virus for which there is no vaccine, and for which, when it erupted, there was no reliable testing as well. And so I think the broader question is: Are we prepared as a society, as a country, for dealing with the next pandemic? Not necessarily drilling it way down into the healthcare systems.
Has there been a surge of testing in our region?
Again, there's a lot of testing that is going on in the community right now, whether that is from the physician or the provider-based practices, or from health departments, or from within the healthcare system. There's a substantial amount of testing going on right now. I do believe that the availability will become more. It's not where we want it to be right now. But it will become more available as production comes online, as supply chains open up. So it's a tough question to answer, though, is is there more absolute testing going on right now than there was before? Because there's various different streams of testing going on.
How many people are being tested now compared to 2 weeks ago?
Again, tough to say because of all those different buckets of testing that are occurring. There has been loosening of the CDC symptoms, so more people would be available to get testing now that might not have been available before, and so the pool or the population of people that should be eligible for testing has definitely increased.
In terms of testing, Illinois took a big step today, and I believe the reporter is referring to the announcement that Illinois has reached its daily testing goal for several days. Mm-hmm. How quickly can the Missouri side ramp up?
Well, I think that would be dependent upon a couple of things. So one would be supply chain. So do we have enough supplies to ramp up more testing? Do you have the staff in order to do the testing? And then it depends on where your capacity is within the system as well to run the tests. So I'm not sure if Illinois are mostly private lab testing or state lab testing. We know that we do have some capacity within the St. Louis region to do more testing, and so it's not a simple question to answer. It depends upon a lot of things falling in place.
What are your thoughts on the antiviral medicine remdesivir?
There are trials going on right now. There is some encouraging data that's coming out of those trials. I don't believe that I have seen the results published yet, and so we'll reserve judgment until it comes out in print.
This reporter writes that she's been hearing about the psychological impact of being on a ventilator mm-hmm. and being sedated for a lengthy period of time. She says that even when patients do physically recover, they still face long-term trauma. Is this a discussion that's taking place among the healthcare systems and the task force? Is there anything being done to address this and ensure that patients who are discharged have support?
As far as whether it's being addressed within the formal task force, that's not an issue that we discuss amongst ourselves, but that is being discussed at the hospital-based level. And so you have to remember we take care of patients that are on ventilators all of the time, even before COVID and even during COVID, we take care of patients that are on the ventilators. And absolutely agree that there is a psychological component to being on a ventilator, to being sedated. There's a lot of issues with sensory perception, things like that. And so all of those issues are recognized by the care teams, and they have developed plans on how we can go about to treat those symptoms. As far as the specific care pathways and things like that, I don't have information here in front of me about that, but I think I can safely say that the care providers at the hospitals do recognize that the impact that has on patients on their long-term psychological well-being, and do look for ways to support them going forward.
Missouri Governor Parson said today that St. Louis is the only region in the state that's seen an increase in hospitalizations between April 7th and 25th, and the figure cited by the governor was an 8% increase over that time, while all other regions are seeing a significant decrease. Are those the numbers you're seeing? And is that data enough to consider a statewide opening with certain regions implementing their own rules?
So as you've noticed even in our presentation today, that the hospitalization rate did increase over that time period, and that percentage is probably fairly close. So no issues there. As far as the reopening goes, one of the goals of reopening, or one of the things you want to see before reopening, is a decrease in transmission in the community. And one of the more robust data sources that we have is hospitalized patients with COVID. And so, and it is correct that the spread of disease is different in different communities, and for various reasons. We know it hits urban areas harder than rural areas, things like that. And so, a part of the answer for reopening is sometimes it can be locally driven, particularly in rural versus urban areas. And so, you have to take all of that into consideration when local leaders are trying to figure out when to reopen. I will tell you though that the decisions by St. Louis County, St. Louis City, their shelter-in-place orders and their continued shelter-in-place orders, I think are absolutely the right move right now because of the still continued high number of hospitalizations that we have. And we'll continue to monitor those numbers. And when we feel confident that we're on the downward slide on those, that's when we can have more definitive discussions about how and when we can reopen.
Thank you. That concludes the list of questions received from members of the media prior to and during today's briefing. In the morning, we'll accept questions from members of the afternoon for tomorrow afternoon's live stream. Thank you for tuning in.